Greetings, everyone, to the Win Via Trust podcast. I am Michael Rabinowitz, and in this podcast, I speak directly with leaders and newsmakers to provide you with both practical guidance and fresh inspiration as you think about trust in your own leadership journey. Today, we are very fortunate to talk with Dr. Harry Leider, a visionary physician executive with over 25 years of experience as a healthcare executive and entrepreneur, with extensive experience serving in C-suite roles, advancing breakthroughs in patient care across multiple sectors of the healthcare industry. Some career highlights include being the chief medical officer of Walgreens, the CEO of multiple biotech startups, a faculty member at the Harvard Medical School and Perry School of Business, and president of the American Association for Physician Leadership. He currently advises biotech and health tech as fractional chief medical and strategy officer through his own consulting firm. Harry, thanks so much for joining us today.
Michael, thank you so much for the opportunity. We've known each other for so many years. It's just a delight to be on your podcast.
Well, you are very kind, and thank you again. Let me start by asking you, what inspired you to pursue a career in which you became both an expert in business and medicine?
That's a great question. Medicine fascinated me from an early age. I love science. I love solving puzzles, and science and puzzles is what being a doctor is all about. And I like the idea of helping people. And I did get some friendly or familiar pressure from my father, who wanted to become a physician. He was an engineer and never did. So I was the eldest son, and there was a little bit of family pressure to become a doctor, which was constructive. But I got turned on to leadership activities in college and did a lot, and really got excited by the idea of multiplying what you can accomplish by building teams and surrounding yourselves with talented people and accomplishing more. And even on a collegiate level, I got experience with that. So then when I finished all my medical training, I had this unique opportunity to be in a fellowship program that was very unique, that sponsored 25 doctors a year. It's called the Robert Wood Johnson Clinical Scholars Program. They sponsor you to study public health, and you could get a master's of public health degree or an MBA. And that's where I had the idea that if I could get into this program, I could learn something about public health and business. And the big idea, that I'll pause because I'm giving you a long answer to a very short question, is when you're a doctor. I'm an internist, I'm a primary care doctor. You might have a panel of 2,000 patients, and in a given year, you might touch 500 or 1,000 of them, maybe 1,500. But the big idea about public health and what we now call population health, and where I've spent my career, is you can create programs that touch hundreds of thousands of people. And when I was at Walgreens, millions of people. And that's what really got me excited. It wasn't business just to be a businessman. It was business to build platforms to improve health, what I call at scale.
Oh, and at scale, you certainly did. Was there a piece of advice that really helped you think through strategically your career path?
Uh, I don't know whether it was advice as it was mentorship.
Mhm.
I came out of this program. I'd done all my medical training. I'd done a project. I studied, blah, 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 got an MBA. You know what? I really was still a novice at leadership, Michael. And in my first role, I was in a nonprofit health plan in Boston. It's now called Harvard Pilgrim. It was Harvard Community Health Plan at the time, run by doctors. And I was helping to run a department with a chief of medicine who was more experienced. And many of the docs had 20 years of experience beyond me. And I didn't understand that just because you have all this training and you're smart, you can't tell professionals what to do, who especially have more experience than you do. So this guy ended up mentoring me. I got hooked up with a mentor that was really, really good at leadership. I learned that leadership isn't about just getting an MBA. It's not just about being smart. You really have to have a whole new set of skills. So that was foundational for me.
Oh, that's tremendous. And I know you mentor a lot of other people giving back. You know, what we're focusing mostly around here is around trust in this podcast. Trust has played a vital role in your leadership and many partnerships with others. Can you first tell me what trust means to you?
Yeah. And in healthcare in particular, trust has a higher meaning, I think, than trust in business in general. Though I think, I love your podcast and your thesis. I think trust is important in every realm of business, because you want to follow, work for, collaborate with leaders you trust. But in healthcare, it has a higher meaning. And that is most healthcare services either touch doctors or patients in some way. And we're involved with programs and services and tools that impact patients' lives. And therefore, if you don't have trust, people could get hurt. People might not have a good outcome. So I think we have to have trust in our leaders and people who are developing products and services, whether they be biopharma tech or they be a digital telemedicine program or an app or whatever. So for me, trust is about whatever you're offering is going to help people on their journey in terms of wellness or health.
Mhm. One of the companies you worked for, specifically when you were chief medical officer for Walgreens, really played up on that trust theme. And it was even part of their branding and tagline. And I know you were a big part of
Yeah.
their management direction and steering towards that trust image. How do you think they captivated patients and customers to believe in that trust?
Yeah, there were multiple levels to it. At a very foundational level, there's probably only 20, 25 iconic brands in America that go back to like 1900 that people
Mhm,
look at Coca-Cola, you know? In
mhm,
healthcare, Walgreens is one of the few. It was founded in 1901, and people have a very nostalgic, warm feeling towards the corner pharmacy. And Walgreens certainly embodied that. At its peak, it had like 9,000 pharmacies in the best corners of America. 60% of people in America lived within 3 miles of a Walgreens. It's a little smaller today. But then there's the other thing they had going for them, and we leveraged it a lot in a positive way, is there's research, Michael, and you probably know this because you've been in the field a long time, that patients, consumers, I'll use them interchangeably a little, they actually trust their pharmacist in many cases more than their doctor. Why is that? Well, they interact with them more. Like a diabetic might be going to the pharmacy 12 to 20 times a year. They might only see their doctor twice. Doctors are sometimes rushed. Pharmacists are right out there answering questions. So the trusted image of a pharmacist was something that was embedded in the company. Then we use that as a lever to offer other services, our clinics, our vaccinations. The whole idea of when we moved in before the COVID pandemic to vaccinating people with flu and then eventually COVID. There's something about keeping people healthy with vaccines that embodies trust. So the brain really evolved over the years as a place where people could go in their neighborhood to
mhm.
get advice, ask the pharmacist, what best over the counter thing can I use for a cold? My kid's sick, and get these other services. So it really was a powerful combination.
It really is, and critical for Walgreens is surviving a lot of the competitive pressures that they had.
Yeah.
Now, you have partnered with many organizations and leaders throughout your career.
Yeah.
Can you walk me through maybe one partnership that worked extremely well for you and why?
Mhm. In an executive role or more in my consulting role today, Michael?
I think never comes to mind.
Okay. I think going back to the Walgreens experience, I helped Walgreens launch their very first digital health and telemedicine program going back to like around 2015. Some of this is going to sound quaint now because telemedicine is everywhere and
Mhm,
digital health everywhere, but back then it wasn't. So I helped Walgreens offer, we have an app which was used by 2 million people a day. Already we had this one of the best healthcare apps in America because people were using it to manage their prescriptions. So I had the idea and developed it with some others that we should build on top of that the ability to schedule a telemedicine appointment with a doctor. And then ultimately we offered some tools where we rewarded our consumers who had the app for recording their steps on their phone. And they got loyalty points they could use in the Walgreens for purchases and all that kind of thing, for steps or weighing themselves, things like that. The partnership for the telemedicine was with a company called MD Live, which is now a subsidiary of Evernorth, which is Cigna. And that went really, really well. They provided the service. I didn't think it made sense for Walgreens to build a doctor platform. And they had access to our patient population. It was great synergy. And then we moved into behavioral health with mental health counseling visits as well. So I was very proud of that.
And you should be. A lot of that framework still exists today. I know the loyalty program is doing extremely well.
right?
And and actually, you've been a big leader or innovator in the digital health space in general, advising many digital health companies and leading some of them. How do you overcome some of the additional barriers associated with emerging technology to
Yeah,
achieve customers' trust?
yeah. I think the number one challenge with these technologies is not the technology itself,
Mhm.
it's patient engagement. So when you offer, let's say, a typical health plan offers a digital program to support people with diabetes or pre-diabetes. By the way, 40% of our population has pre-diabetes or diabetes. It's huge,
Mhm.
right?
Mhm.
So you have a digital program which can coach them on their diet and their exercise and their medication here. Sounds pretty simple, right? But in general, if a health plan or a medical group or anybody offers a program, only 15% of people will use it. And that's a high number.
Mhm.
And I think trust plays a role in that. A learning that I got recently from a company I work with which does remote patient monitoring, seniors and puts blood pressure cuffs in their homes and things like that. It's sponsored by Medicare, Medicare Advantage plans. When the program is offered by their physician, as sponsored by the physician, the adoption rate or engagement rate actually can go up 50 to 60% instead of 15%. And why is that? Because the patient sees this as being offered by their trusted provider, not by a bureaucratic health plan or a vendor company, that I work for, but it's because of the trust they have with their doctor. So I think offering these digital services really works well when you're leveraging the trust of the provider that's in place already. Otherwise, it's hard.
That's very interesting because you're speaking about digital, which is a non-personal media to a great
Right.
degree, and yet
Right.
trust is inspired by the relationship they have with their physician.
Exactly.
Almost goes back to the pharmacist that you talked about, having that
Right.
relationship with that pharmacist that propels them to believe in that particular pharmacy. Very interesting.
Yeah.
Uh,
Yeah.
in your current role, you provide fractional support
Right.
and you do it to innovative or emerging healthcare companies, largely companies that you may not know of before they reach out to you. How do you assess whether they're trustworthy enough to work with?
It's a really important question, and I'll back into it with a story. So, fractional services, just briefly, what that means is rather than work for one healthcare company like I did at Walgreens or other companies I worked for, I work for several part time, maybe a day a week or 2 days a week. They get the benefit of my support on a part time basis and it works financially for them. And I get to work with a lot of interesting entrepreneurs and exciting ideas. The story is not too long ago, I won't mention any names. I had a client earlier this year, and they had a really exciting product, a digital tool that could help diagnose high blood pressure and perhaps diabetes. I, over time, and maybe a little belatedly, looked into the data, the research data to look at how accurate the tool was.
Mhm.
And much to my chagrin, for one of the metrics, I won't go into too much detail because I don't want to be too public about it, but the data wasn't that good. And it concerned me that the tool might alert consumers slash patients that they had a risk of heart disease or stroke when they might not. Because every test, every tool has a precision to it, right? An
Right.
accuracy. Even laboratory tests aren't perfect. So anyway, I discussed it with the CEO, the founder, and I said, I don't think we can promote this the way we're promoting it. And he said, well, that's the key value proposition. We're not going to have a business if we don't promote it this way. That was essentially the conversation. And I said, well, I'm sorry, I can't work with you. And I gave up some income, but it was the right thing to do. I mean, who I am as a physician leader is built upon people trusting if I'm associated with something that it's high quality and it does what it says it's going to do.
That's a great story. That really reaffirms why you're on the podcast. You are exemplary in terms of the various traits of being trustworthy and hold to your values is not
Yeah,
easy.
it's
Uh,
not easy. No, no, it's not.
I know there's other instances when you did this as well.
I mean, you have nothing more than your reputation at the end of the day, right?
That's so true. In your background, there's so many things we could delve into because you really are at the cross section of so many great disciplines, medicine, business, obviously digital as well. And one of the questions I get off asked is about the future, including AI. Given your expertise and just great perspectives, can you offer some insight as to where you think AI is going to have its use and where people are going to wind up trusting it the most?
Yeah, it's a foundational question, and everybody's kind of trying to figure that out. I think we've already seen in healthcare and in other industries that AI is really good at creating efficiencies in what I would call back office processes. So in the medical world, AI can transcribe doctor's notes, and they no longer have to, do more than just have AI listen to their visit with a patient. They don't have to dictate, right? AI can automate sending in claims to insurance companies and trying to put together medical records when the insurance company is doing a prior authorization, right? Needs to approve something. I'm just
Mhm.
giving you some examples, reminding people about things AI can do. But when it touches diagnosis or treatment, this is where AI and the trust issue gets a little bit dicey right now, right? Can we really trust AI to make a diagnosis to say you have just like I said, a risk of a stroke or a heart attack, or treatment, recommended treatment? My belief is even today it can be used as a tool to present doctors with information to really it's concise to review. But these really critical diagnosis or treatment decisions need to still be supervised by a professional. That's my belief. And
Oh,
because of that, I don't think we're at a point where people will trust AI to be their doctor.
I think that's very fair. It'll be interesting to see how this all sorts out as the technology continues to improve and information and misinformation continues to be batted around.
Just want to make one
Yeah.
comment. So some of your listeners know the term with AI with hallucination, where sometimes the AI
Mhm.
will say something that isn't true. And just as a professional, I've sometimes would use AI to do literature searches. I used to manually do it in a tool that's been around for a long time called PubMed, and you put in your keywords and it kicks out articles. But AI can now do this very effectively and give you summaries that are easier to read. And I found myself on a couple occasions seeing the output from AI about a question and saying, that's just not right. Can't be right. And I'll say to, and I won't tell you which AI edge, they all have their weaknesses. I said, you just said X. You just said that this is the likely scenario. And it goes, oh, I'm so sorry. I looked and there really was no paper that said that. That's scary. And that actually happens. That's hallucination.
I've had that same experience, and I'm sure some of our listeners have as well. How do you go back to it now, having uncovered that some of the information they provide you is false?
I think that's where my professional background helps. I mean, you have medical training. If something comes up that doesn't, like on that case, doesn't kind of make sense, that's a red flag. Sometimes I double check things on different AI engines and compare
And
the results. Sometimes I go back to the old PubMed and look at the actual papers themselves. But at the end of the day, AI can give you the references it's basing its decisions on. And if you take the time, you can go in and actually look at the papers, the research, and all that. But that's getting back to the manual piece. That's getting back to being a doctor.
yep, very true. Sometimes the more we advance, the more we go back to the basics.
Well, I do think it can free doctors up and other healthcare professionals to spend more time with patients on the important things because they're not spending as much time dictating notes, calling insurance companies, or all that kind of. So I think that is the positive aspect of AI.
Yep, a lot of the back office roles, that's efficiencies that certainly AI can help with.
Yeah.
As we're wrapping up the last few minutes of this podcast, are there any words of wisdom that you would leave our listeners who are at different points of their leadership journey and maybe just beginning to understand how to fully leverage trust to better inspire and build their organizations to success?
I have two ideas, and maybe it's longer than you would have expected. But the first is I really recommend that your listeners consider reading Adam Grant's book, Give and Take. Adam Grant is a professor at Wharton, has for like 7 years won the student award of the most popular business professor. He's written a number of popular books, but Give and Take is all about Is it better to be a taker, meaning you conduct yourself in a way where you maximize what you get from other people to be successful? Is it better to be a giver where you're altruistic and you try to help other people and the world comes around and you benefit? Or should you be a matcher where you give people things if they give you things, be transactional? And it's a fascinating book. And he looks at the evidence, not just an opinion. And the evidence suggests some people say, oh, it's best to be a giver. Well, the conclusion is it is. But the caveat is that you do need to sometimes set up a framework where you don't get taken advantage of, because that can happen if you're always a giver. But the idea that being a giver is the better style in the long run for business, I think goes along with trust. I trust people that are trying to help and being supportive, not because they want something back from me in every case. So that's one thing. Adam Grant's book. The other thing is I'm writing a newsletter called Good Ideas to Great Healthcare Companies on LinkedIn, and I recently published an issue. The end of the issue was, and I think this pertains in a lot of industries, but particularly in healthcare, ideas generate interest.
Mm-hmm.
So good ideas generate interest. You have an exciting idea.
Mm-hmm.
Evidence generates trust or begets trust, meaning you have data, you can prove that what you say actually is true, and trust enables scale. So in the center of that is you have a great idea, you have to prove that it works to people, and that gets them to trust what you say is true, and then people will adopt what you're promoting. So at the core of that whole triad is trust. I think that's the path to scaling any business, is having a good idea, proving that it works with data, and then using that to build trust and to build a business.
Wow. Very, very thoughtful way to end our podcast. I know we were very fortunate to have you, Harry, and you certainly didn't disappoint. Let me encourage everyone to subscribe to the Win Via Trust podcast. And I want to thank again you, Harry, for joining us and everyone who was listening. Thank you so much. Have a great day.
It was really a pleasure, Michael. Thank you.